Hey everyone, welcome back to the Other C Word. Today's guest is Dr. Mamina Turegano. She's a triple board certified doctor, and we will be talking all things related to dermatology and cancer. So, everything from how our skin is affected during cancer treatments to hair growth options, and also what we can do to protect ourselves from potentially getting skin cancer. So, let's get into it. Hey everyone, welcome back. Today we have Dr. Mamina with us. Thank you so much for being here. Welcome to the pod.
Thank you so much for having me.
Absolutely. So you are triple board certified in dermatology, internal medicine, and I'm going to butcher this, but is it dermatopathologist?
Dermatopathology, yes.
Okay.
Close.
Thank you. So I would love to start with your personal relationship to cancer. And I know you've seen it in your work, but I know that you also have become an advocate in the cancer community. And so if we could kick it off with that, and would love to just get your take on or your experience with cancer and how you've been brought into this world.
Yes. So, as a dermatologist, we do treat a lot of skin cancers, and skin cancers occur in about 20% of Americans. So it's actually pretty common. But yes, personally, I have had some family members deal with cancer, namely my father, who passed away from prostate cancer. So we do have the BRCA2 gene that runs in our family. And so that puts whoever has it at much higher risk. And men who have the BRCA2 gene usually die from prostate cancer. We found out that he had it because my aunt had a cancer and she got tested. And so then that's how we found out with my dad. But
Okay.
yeah, interestingly, both sides of my family, so that's my dad's side of the family. And then his mom probably had the BRCA2 gene. This was in this was in the early 70s, where she passed away from a metastatic cancer at the age of 50.
Mm-hmm.
And then on my mom's side, my mom is Japanese. She does not have cancer, but her father passed away from a rare cancer, gallbladder cancer or cholangiocarcinoma.
Okay.
And then, sorry, getting back to my dad's side of the family, his mom did. And then my grandfather, his dad had colon cancer, but was able to treat that with radiation. It was very small. So anyways, yes, it's family members and just treating patients regularly.
Yeah, got it. So I also have the BRCA2 gene. When I got diagnosed with
Mm,
metastatic breast cancer,
mm,
they ran the panel. And so that's how we figured out that I've got BRCA2. And I really encouraged my siblings to get tested at the same time. And so it came back that they also are both BRCA2 positive as
oh,
well.
really?
And
Mm,
so I totally relate to that. But I think
oh,
I think it's obviously great to know. Obviously, it would be better to not have these, but at least there's an identifier, and
yes,
it gives you some sort of leeway or leading path to get ahead
hmm
and try to get tested on a regular basis.
definitely. Yeah, I got tested because there's a 50% chance that I have it, but thankfully I was negative. I have
That's
three
great.
sisters. I'm the oldest of four girls, and the three of them have not gotten tested yet. So
Mhm.
I don't know what's going on,
Yeah,
but everyone's healthy so far. So,
we had a similar situation. So my brother right away was very much like, I'm going to go get tested. My sister took a while to go and do that. And I think for everyone, it's a very personal journey and decision. And, it's like you obviously want to take care of your health, but knowing such a big aspect of it is scary. And so I think a lot of people do shy away from it.
yeah, definitely. I think that probably the reason why they haven't gotten tested yet is because it's yeah, I think they're not ready yet. But they will when they're ready. Mhm.
Yeah. Yeah, absolutely. Well, thank you for sharing that. I'm so sorry about your father. Um, it seems like that was kind of the impetus for you to get into the cancer advocacy world? I know you've joined a couple of organizations and you're very active in that. How has that experience been for you?
It's been really fulfilling, because, obviously it's a tragedy that my father passed away at a young age, but it's helped motivate me to be an advocate and bring more awareness to just that whole field of like what to be looking out for. Definitely in the dermatology realm with skin cancers, but also like what are the healthy things that we could just do in our lives that can just decrease the risk of cancers and other chronic diseases.
Yeah,
Just become very passionate about like taking a very holistic and like healthy lifestyle approach to care.
that's absolutely great. So maybe we can dive into that. So, I guess before the holistic approach, for people listening in that, already have a cancer diagnosis, maybe they're going through chemo, radiation, there's a bunch of like, as you know, skin issues that arise when you're going through these treatments. So dry skin, rashes, itching, hyperpigmentation. What are some things, either medicines or holistic treatments or approaches that they can take to help with those side effects?
Yeah, I would say, yeah, skin is such a common, I guess, sort of punching bag when it comes to like just where a lot of the side effects come out with chemo treatment and radiation. I'll start with radiation because I feel like that's a little bit more straightforward. And thankfully, we don't see as many issues, but definitely there's something called radiation dermatitis where the skin can get irritated or raw at the sites of radiation. And so the biggest thing with that is really making sure that you're using products that keep your skin barrier healthy and nourished. And it doesn't have to be anything fancy. It could even be a simple moisturizer. But there are balms, I would say looking for balms that are thicker, that may include things like zinc. One of my
Mhm.
favorite products actually is by a brand called La Roche-Posay, and they even specifically cater to patients who are going through chemotherapy or radiation, and it's their Cicaplast balm. It's just a balm that has obviously like very, very effective moisturizing ingredients, but also soothing ingredients and skin barrier protecting ingredients. So big fan of that. Um, and I mean, even like simple petroleum jelly products like Vaseline ointment, if you're not sure what to look out for, if you don't have access to the Cicaplast, you could even use that. And like diaper rash cream, that's like another thing.
Okay, so more like thick versions versus like a thinner lotion that's like water based.
Exactly. Yes. So look for things that are like in jars as opposed to pumps, things that are like in jars or tubes that are thicker in consistency.
Okay, got it. What is it Aquaphor? What do you think about that?
Yeah. Yeah. I'm a huge fan of Aquaphor. So Aquaphor is mostly petrolatum or petroleum jelly, but it has some other soothing ingredients like bisabolol, which uh, is just like kind of a soothing antioxidant ingredient, and panthenol. And it also has like a lanolin derivative, which lanolin is used a lot in like nipple creams, like for people who breastfeed and get raw nipples. So yeah, Aquaphor is a huge favorite of
Okay.
derms. And
Okay.
sorry,
Great.
panthenol is in Cicaplast. There's a lot of it's like a whole different language. Sorry, so I
Yeah.
got to get it all straight. But
Awesome.
yes, so huge fan of Aquaphor.
And do you recommend that people put these on prior to radiation, or is it really just like healing after they get radiation done?
Yeah, I think that prior to radiation, you don't necessarily need to. I do think that if you like have like a healthy moisturizing regimen, so for just a daily moisturizer, so you could look for something that's a lotion or something that's easier to apply, that's not as thick or greasy. Using something like that regularly just to make sure that at baseline your skin is at a healthy and hydrated level, and then like doing other things when it comes to bathing, like minimizing hot showers and harsh soaps, just like gentle moisturizing soaps, things that can minimize like dry skin. And
Okay.
moisturization is best on damp skin, so like within the first 3 minutes of getting out of the shower or bath is the best time to moisturize.
Okay. Okay, that's great. And then what about so people from different ethnic cultural backgrounds, are certain ones more likely to have skin issues related to radiation?
Not necessarily that I've seen, but for sure in people who do have darker skin tones, they are at much higher risk for developing hyperpigmentation or darkening of the skin after any kind of insult to the skin. So, skincare also revolves around what can we do to help lighten it. Usually, our goal is to make sure that the inflammation and the skin barrier is healed before we provide medicines to help lighten the skin, because sometimes that can be a little bit irritating to the skin depending on how strong the skin lightening cream is. But
Mhm.
we focus on first healing the skin, and then we can then give some medicine to help lighten it.
Okay. And are those medicines usually prescribed, or are there any over the counter medications that help with hyperpigmentation that you would recommend?
We typically do a prescription because of how much faster prescription medicines work, but there are like over the counter options available, and it depends on like what body area, because something would be different for the face than it would be for the body. There are like different body moisturizers out there that have some skin lightening ingredients, like things like niacinamide and even like gentle exfoliating acids, gentle levels of glycolic acid or lactic acid, or even retinols. Those can help with the body. And then for prescriptions, we would do something like hydroquinone. And then there's like so many skin lightening products that are catered more so for the face. Um, so yeah, those are different, but for the body, I would say something like that. Looking for a body moisturizer with those ingredients.
Okay. Okay. And I've heard mixed things on hydroquinone. I know it's kind of had a bad rep over the years. What is your take on it?
Yeah, my take is that people just use it in, like, how do I say it, in like smaller doses. So it's not something that I want people to use long term.
Okay.
Um, and just out of caution, we don't recommend it for people who are pregnant or breastfeeding. Um, but I would say like just like for a 3 month time period, I'm comfortable with that.
Okay. So not years on end, but use it for a short period of time.
Exactly.
Okay. Okay. Got it. Okay. So that's the skin. I know nails are also a big issue. So nails getting brittle, having ridges form on them, discolorations. Um, is that well, is it one common, and then two, what can someone do about helping with their nails?
Yeah, nails are a common also culprit of chemotherapy issues. And nails, yes, you named them. So people will get like very brittle nails just because their people's sort of nutrient, I guess, status is different and affected by chemo because their gut's affected. And that can lead to brittleness. And then ridging. So there's vertical ridging and horizontal ridging, and vertical ridging could be related to same thing with nutrient deficiencies and like decreased hydration. We see horizontal ridging where they get like these horizontal bands or ridges, like indentations across the nail, and that usually is when the body undergoes like an excessive insult, like a very severe illness, or yeah, like a severe bout of like a severe run with chemotherapy. So in certain patients, depending on the chemo medicine, they'll get like a series of like horizontal ridges on their nails.
Yeah. And then, so is there anything that they can do for that, or is it really just letting it grow out?
Great question. Yes. I think that I think that the best bet is really letting it grow out, but I will recommend like certain nail conditioners so that the skin around the nails is as healthy as possible, because that all plays a role in the cells below the like, so where the cuticle is, below that is like what's called the nail matrix, and that's where the nail is being built. And so you just nourishing the nail as much as possible. There's a brand, it's such a small brand. It's called Elon, like Elon Musk.
Okay.
Um, that makes like different nail moisturizers that I will recommend for people with, yeah, brittle nails.
Okay. Got it. So it sounds like moisturizing hydration is a big part of both the skin and the nails.
Definitely.
Do you what about like water intake? Like if you up your water intake during chemo radiation, is that something that would help out as well?
Sure. Yeah. Hydration, having adequate hydration is always important because, I mean, it just helps your body run better. And if your body runs better, your skin will be healthier. I think that drinking more water doesn't necessarily equate to like your skin will automatically be healthy. I think it's a little bit more complex, but hydration, if your body is hydrated, then it will only have like a positive downstream effect on your other organs, including your skin, to function better.
Okay. Got it. And then what about electrolytes? So like if you add electrolyte powders to your water, does that also help or not necessarily for skin and nails?
I think that indirectly it can help skin and nails just because I think with electrolytes, it can improve the actual hydration status in the body. Like if you do have like more sodium um, in your water, it can match more the the same type of fluids that are in our bodies. So I think it just improves hydration, which then
Okay.
can indirectly help the skin.
Okay. Okay, got it. Maybe we can switch a little bit and talk about hair. So, hair loss is a very common, side effect of a lot of chemotherapies, a lot of targeted hormone treatments. What is your take on, I think, two things that I'd love to talk about cold capping and then red light therapy?
Yeah, I'm definitely a fan of the cold cap. I think it's like very uncomfortable, but and expensive. Although I think some insurance companies are turning around and
Starting to
like
cover it.
starting to
Yes.
cover it, which is
Yeah.
amazing. But I do think there's definitely evidence to support its effectiveness. It's just like I said, uncomfortable and expensive.
Hmm.
So it depends on like how important your hair is.
Yeah.
And then I am also a big fan of red light as well.
Okay.
So there are a variety of different ways that you can use red light for your scalp. You could come in like a cap form, like a hat or a helmet, or sometimes a comb or a headband. And there's so many different brands out there, and it's hard to say which one the best one is.
Right.
I think there was like a study that was supposed to be done between different brands. It could have been published by now, but I would, and it's tough because they're also like, there's a lot of really expensive ones too. So it's like, it would be good to know which one's the most effective one. But anyways, I'm not going to go into that. I'll just say that I do think that red light therapy is helpful. The red light does sort of help activate and energize the cells at the hair follicle level so that they're still working well and wanting to build more hair.
Got it. Is it common with red light that you may actually have initially, like you might see more hair fall out and then it'll grow back, or is that not common? Because that's something that I experienced, but I wasn't sure if that was a common thing.
That I don't think is a common thing. I
Okay.
wouldn't be surprised because sometimes hair cycles have to reset to to kind of start and to start at the right cycle for regrowth. But with red light, I typically don't see that. We see that all the time with topical minoxidil, sometimes oral minoxidil too, aka Rogaine is a topical
Yes.
minoxidil. But I don't see that as much with red light.
Okay, and now that you're saying that, I actually was taking oral minoxidil at the same time when I started red light, so it could have been from that, it seems like.
Yes, that's probably the bigger culprit.
Okay.
And then oral minoxidil too is something that I would recommend. Depending on the patient's medical history, it's something that I would also recommend for somebody who wants to keep their hair during chemo.
Yes, absolutely. And I think from my experience, it was minimal to zero side effects, and so I had a good
Awesome,
experience on it. Yeah.
that's great.
Um,
Yeah, I think that typically it is well tolerated, so that's good to hear.
okay, great. With the red light, if I recall correctly, there's different. wavelengths that you can is it wavelengths that they specify on the product? So like it'll go up to like 400 to 600 or 600 to 800. I forget the exact numbers. Is there a recommendation that you have on if someone's looking for a red light cap, like what they should get maybe in their price point?
There is not a wavelength that and there's a certain range with the red light, but I don't have like a
Okay.
specific number range to recommend. Um, but I guess if people need a little bit of guidance on what to look for with red light caps or any kind of red light device
Mhm.
is to see that that device was FDA cleared, so that there was some kind of almost approval process by a third party in that way, just to make it a little bit more legitimate.
Okay. Okay, great. And then for people listening in, so a lot of these devices are really expensive. One place that I have found, which is interesting, to buy some of these things that are, holistic, but on the pricier end, is Facebook Marketplace. A lot of people do try these and end up not using them, or they even buy them and don't ever use them. So you can find them brand new in box. And so I personally have had success. I've bought a water filtration machine on there. I've bought a really great juicer on there. So definitely, I think if you're looking for a place to buy these things at a lower price point, check that out.
What a great pro tip. I love
Yes.
that. Yes.
Yes. Okay. And then last thing about hair, I get asked a lot about, are there any specific shampoos, conditioners that you recommend that someone can use to help with their hair growth?
Yeah, I feel like that's such a common question because I'm honestly a bigger fan of hair growth serums as opposed to shampoos and conditioners. But um, when it comes to shampoos and conditioners, there are a few ingredients that I do think are helpful to look out for. And one of them is zinc. Zinc is something that you can find often in anti dandruff shampoos, usually in the form of something called parathione zinc. And that has like anti inflammatory effects. It helps with dandruff because zinc is sort of anti inflammatory with the yeast that contributes to acne. Sorry, not acne, dandruff. Yeast is is what drives dandruff on the scalp. The so so but even so, something simple like Head and Shoulders, I think can make a difference. There were a couple small studies to show that topical zinc can be helpful for hair loss. And then another ingredient that I'm also a fan of for people who deal with hair loss is something called ketoconazole. And that is in the shampoo called Nizoral shampoo. Their generic is ketoconazole shampoo, which is also used for dandruff because ketoconazole is an anti-yeast ingredient. But interestingly, ketoconazole can also work locally on the hormonal level of the scalp and hormonally help with the changes that may contribute to hair loss. Usually, like if people have male pattern or female pattern hair loss, that's like very hormonally driven. So ketoconazole, interestingly, can help with that. So those are the two things that I look out for. In terms of other brands, I've also been a fan of the Nioxin brand. They have some interesting ingredients that also help really nourish the scalp. And caffeine is another ingredient to also look for as well in terms of helping stimulate hair growth.
Okay. Okay, great. And then what are your thoughts on Nutrafol?
I am a fan of Nutrafol. I have been recommending Nutrafol um, since 2017.
Okay.
So I would say, yeah, like almost 8 years. And I think that Nutrafol covers a lot of ground. It has a lot of different goodies in it, antioxidants, minerals, different like herbal complexes, anti-inflammatory ingredients, in addition to the hydrolyzed marine collagen, which is the main ingredient that has been shown to help with hair regrowth. I think that before somebody starts Nutrafol, they should talk to their doctor because there are a lot of ingredients in Nutrafol. It may overlap with some other supplements you may already be taking. So I
Right.
would just be cautious about that. Yeah.
Yeah.
Um, so yeah, but
Yeah.
otherwise, I'm a fan.
Yeah. And I agree. I think the first treatment that I was on, um, my oncologist said Nutrafol wasn't okay to take with it, and then another treatment I was on, it was okay to take with it. So I definitely agree. Like, definitely check with your dermatologist as well as your oncologist on whether it's okay to take for you.
Yeah. And your hair looks amazing, by the
Thank you,
way.
thank you,
So you've done all the right things.
thank you. I did want to ask you, what about frequency of hair washing? Because that's something that I mean, in my experience, I think has really helped me with my hair. I actually don't wash my hair that frequently. If my husband's listening, please, you can mute this part, but it really isn't that frequent. Do you have a recommendation on how often you should wash your hair?
Well, I think that's a really interesting thing that you brought up because we notice that when people are having hair loss, it is very disturbing to them. And where they notice it the most is in the shower and just seeing all this hair fall out in their hands. And subconsciously, people are like, oh my gosh, the shower is like whenever I wash my hair, that's like when so much of my hair is falling out. I kind of want to back down and wash my hair less frequently. But actually, that's doing a disservice to the person. If somebody's losing hair, we actually recommend not going less frequent, if anything, even going more frequent. And
Oh,
one of the
interesting.
yeah, and one of the main reasons for that is, first of all, the shower is not going to be the reason why your hair is falling out. The hair is going to fall out regardless. It just was the shower was just like the extra like physical trigger that's just pushing the hair out. But that hair was going to fall out, like I said, regardless. But what happens is if you spread out the frequency of your hair washings, the oil that builds up on your scalp is then more food for the yeast that naturally lives in our microbiome on the scalp. We all have this yeast, but it can feed the yeast, and then the byproduct of the yeast is inflammation. Inflammation then can trigger even more hair loss. And so what I see more often is that when people wash their hair less frequently, their hair loss is worse. Now,
Wow.
yeah, but so it's cool that your hair is better, that you washed it less frequently. And everyone's different. Some people
Sure.
um need to wash their hair every day. Some people, I would say, from just for the standard person, because there's so many different hair types too, with like textured hair. Um, I would say once a week is fine, but like Caucasian hair, like every other day,
Yeah.
or a couple times a week, even. So it depends on hair type, but what I discourage people to do is wash their hair less frequently if they are noticing hair loss, because that can potentially put their hair more at risk. But so how often do you wash your hair?
Once a week.
Once a week. Okay.
Yeah. Yeah.
Okay. Yeah. And if that works for you, then that's great.
Yeah.
I would say
I used
probably
to
not to go more than that.
Yeah, I used to be an every other day hair washer, and then I think for me it was related also just to lifestyle, right? So I wasn't working out, I wasn't doing as many like extraneous activities. So I didn't feel like my hair was
Mm,
getting that like oily feeling. And
mm,
so I
mhm,
started pushing it out. And then when I did start having more hair loss, it was very psychological. I felt like every time I was washing my hair, when
mhm.
I saw it coming out like that, it felt like it was the washing the hair that was making it do that. And
Totally.
so I just naturally stopped washing my hair as much.
Mhm,
But again, I was doing things simultaneously. I was doing
mhm.
the red light, I was doing the minoxidil. And so I think those things were definitely, at play. And that is interesting though. I will kind of maybe I'll try to like take it down to like maybe every like 3, 4 days and see if there's
Yeah.
any change there.
Yeah. I would think about that. Yeah.
Okay, great. Okay, so you mentioned zinc a couple of times. So when you said zinc, I, thought of SPF. So would love to chat a little bit about that. Get your take on, which SPF products are good, what ingredients to look at within SPF. And, we all know that SPF is important, but I really want to get your take and, your messaging on how important it actually is.
Yes. So we do definitely know that the sun can definitely alter the DNA in our skin cells, which then those mutations can increase the risk of skin cancer. We 100% know that UV light can do that to DNA in our skin. There's not that many things that we can say that about. if you talk to any cancer epidemiologist. We know that tobacco smoke can increase lung cancer and that UV light can increase skin cancer. Otherwise, everything else, it's still a little bit hazy. There's, of course, a lot of things that are coming out of like different things in our foods and different things in our environment that can trigger cancer. But we know with 100% certainty that tobacco and UV light can increase your risk of certain cancers.
Yeah.
And so doing things to protect your skin from UV light will help prevent you against skin cancer. And sunscreen, we know, blocks UV light. And there's different sunscreen ingredients that work differently in different ways. And some are better at blocking UVA, some are better at blocking UVB. Both play a role in skin cancer, UVA light more so. So anyways, as dermatologists, given how much we see skin cancer, we're a big proponent of sunscreen. Of course, not only that, wearing sun protective clothing, minimizing sun exposure during like the peak UV light hours, which is usually between 10 a.m. and 2 p.m. And yeah, and wearing things like sunglasses too, just because it's hard to put like sunscreen like right around your eyelids and whatnot. And we definitely see like skin cancers on the eyelids and like inside the eyeball too, if you talk to an ophthalmologist. So yeah, but I know there's been like a lot of controversy around sunscreen. And, you know, when we look at sunscreen, there's two different kind of broad categories of ingredients. There's the mineral ingredients, which include things like zinc oxide, and the other one is titanium dioxide. And those do a pretty good job at covering UVA and UVB. And then there's the chemical sunscreens, which are usually ingredients that are harder to pronounce. So if you look on like the back of the sunscreen, you're like, okay, wait, what's this word? But things like, you know, avobenzone, octisalate, octocrylene, and they also work by absorbing UV light and minimizing UV light penetration into your skin cells. And usually there's multiple chemical sunscreens because some are better at blocking like UVA, some are better at blocking UVB. And I feel like there was like a lot of controversy about sunscreen ingredients, like, and people are kind of maybe attributing this more to chemical sunscreens as potentially increasing your risk of cancer, which is false. But I'll go into it because I totally can understand the fear of people when it comes to chemical sunscreens. Mm-hmm. There has been a rise in skin cancers, you know, since the 70s and 80s, but that also coincides with the rise of like excess sun exposure. People are going on vacation, people are tanning way more. So it's
the kind whole of the tanning bed era.
Oh my gosh, yes. Huge. And it's still huge. But a lot of people are mistakenly like correlating the invention of sunscreens with this rise of skin cancers. I do have to say though, that what an interesting observation is that a lot of people aren't using sunscreen correctly. And so when they'll put on a thin layer, which gives them a false sense of confidence, and they'll bake out in the sun longer, and they might end up doing more damage than good because they are getting more sun when they think that the sunscreen's doing the job. And so unfortunately, that's one of the downfalls. I don't think there's enough like education on like the importance of how much sunscreen to use and like how much you need to reapply it. So there's that. But there are fortunately no studies to show that it actually does things to the body to increase your risk of cancers, whether it's solid organ cancers or skin cancers or blood cancers or anything like that.
Right.
But there have been a few different other things that have made people question it potentially causing cancer, because in 2022, Valashore, which is a third-party testing company, did a bunch of studies on like a variety of different sunscreens, like 70 something sunscreens. And they found like a decent amount had like trace amounts of benzene, which is a cancer causing ingredient. It can increase your risk of blood cancers. And that freaked people out. But anyway, so then there was like this huge movement, I feel like, on social media about like how sunscreen causes cancer, but nobody could say whether or not that level of benzene was significant enough to cause cancer. And it was still like such a tiny amount, but it was enough to be like I think like above the level where the FDA says it's significant. But the thing is, we get more benzene exposure. Like if you live in like a busy city, if like being near car exhaust, there's a lot of other
Right.
elements in our environment. So I think it caused a lot of fear in people, but I feel like that's kind of died down a little bit. And but it did bring to question also the chemical sunscreens, because the majority of those sunscreens were chemical, and a lot of them, interesting, were aerosolized. And what they found was that the packaging, it wasn't it wasn't like the ingredients themselves, but it was something about the manufacturing that led to the contaminant of benzene being found or formed
Like the
in the product.
aerosol component and how they
Mostly,
stuck
mostly,
together.
yes, in the aerosol. So, but it had
Okay.
nothing to do with the actual sunscreen ingredients. But anyways, unfortunately, people were like, sunscreen causes cancer because of that. So
Yeah.
there was that. And then of course, there's this huge concern. The last thing I was going to say about sunscreens is this huge concern about potential endocrine disruption, because there are certain chemical sunscreens that have been found in multiple studies, oxybenzone actually being a big one. And now that's not in sunscreens anymore, but sunscreen ingredients potentially being endocrine disruptors. And a lot of these studies were done where the doses were at extremely high amounts, like unrealistic amounts than what we would use. And then they were used, nothing has been done on humans, but they have been done like marine species. And they did see signs of endocrine disruption, which is concerning because endocrine disruption can also potentially increase cancers too, like breast cancer.
Right.
So having said that, there's still not enough evidence to remove the current sunscreens. I'm happy that they removed oxybenzone, but there's not enough for the other ingredients that are out there. So what I recommend is for people who just want to be like super safe, and like if the idea of chemical sunscreens is concerning or anxiety provoking, I would just stick to the mineral sunscreens for now. But if you ask a dermatologist, still the chemical and the mineral are both considered safe.
Okay. Is mineral sunscreen the same as a physical sunscreen?
Yes. So
Okay.
yes, those are both used interchangeably. And I
Okay.
would say the downside of mineral sunscreens is that they tend to be a little bit thicker and chalkier. And so they may not be as elegant. They may make you look a little bit more pale. There's a lot
Right.
of great formulas now where they're like tinted and they can blend in a little bit better. But yeah, so because people are like, well, why doesn't anyone just use mineral sunscreens? But so there's that.
Yeah. No, I think that's great. I think that's a good differentiation. So the ingredients in a physical sunscreen, can you list out which ones you recommend someone can look for?
Yeah. So when you're looking at sunscreen in the sunscreen aisle or or online, the main ingredients or the active ingredients, which is like on the back of the sunscreen bottle, but they'll list it too in the ingredients online, is you want to look for zinc oxide or titanium dioxide. Those are the mineral sunscreens.
Okay. And both are equally as good.
Yeah, I would say if I had to pick one, I would pick zinc. I think
Okay.
zinc is a little bit more effective.
Okay. There's a brand I use, Elta MD. They have a tinted version. I know I'm pretty sure that's zinc oxide in there, but it is on the pricier end. Do you know of any, products that are a little bit more affordable?
Yeah, huge fan of Elta MD. All their products have zinc, but some of them are either hybrid zinc and chemical or just pure zinc.
Mhm.
But in terms of affordable sunscreens, if you want to look for mineral sunscreens, Eucerin has some really nice mineral sunscreens. I've actually been impressed by their tinted sensitive mineral sunscreen. And CeraVe also has affordable mineral sunscreens too. Laura's
Okay.
Posay is another drugstore brand, but they're a little bit also on the pricier side. They're probably similar to Ulta MD, maybe slightly more affordable, but they make excellent sunscreens.
Okay. Okay, great. I know so a lot of people work from home and I think they think because they're not going outside that you don't have to put on sunscreen. I try to always tell people that's not how it works. Would love to get your take on that as well though.
Yes. So when it comes to people thinking that they don't need to wear sunscreen every day, this is what I tell them. These are the four reasons why I tell people they should wear sunscreen every day. One is even if you're indoors, it's just good to get into the habit of wearing it because you never know when you are going to be outside for something. Two, there's there are little things that you do where you do potentially will go outside to check your mail, go outside to walk your dog, sit next to a window. There could be just little bouts, even if it's for a couple minutes a day, but it's that cumulative buildup of daily sun exposure that is what can lead to skin cancers, more so non-melanoma skin cancers, which are way more common than melanoma. Melanoma is the scary one, but it's that chronic daily buildup that one day, like, things will just get pushed over the edge. So to me, that's important. I sort of already alluded to this, but the third reason is like windows. Yes, like
Yeah.
UVA light penetrates window glass, and so if you're going to be near a window, definitely important to wear sunscreen. And the fourth reason is, I said daily habit, cumulative. And okay, maybe it's just three reasons.
Okay.
But yes, those are the three reasons.
Okay, great. Awesome. Okay, thank you so much for sharing that. I think that's super helpful. And then maybe the last thing we could chat about is so I've been told that once you get diagnosed with a cancer, whether it's breast cancer, prostate cancer, colon cancer, whichever type of cancer, you are now at a higher risk for developing or getting a secondary cancer.
Yeah.
Is that true? What is your take on it? And then if someone, if that is true, what can someone look out for to see if they potentially have a skin cancer? How do they monitor themselves?
Yeah, I think that's great. Yeah, so anyone who's had a history of any kind of cancer, we do recommend seeing a dermatologist regularly. I usually like to see those patients once a year for a full body skin check because, yes, you're right. You are at risk for skin cancers. It's interesting. Like sometimes I'll diagnose skin cancer in somebody and then because I'll see the reverse, like I'll diagnose skin cancer and then like they'll have some kind of like breast cancer or colon cancer diagnosed, that
Interesting.
year or a couple years later. So sometimes it could almost be like a warning sign too, like there could be some other cancers going on. But yes, so I would recommend seeing a dermatologist regularly in terms of things to look out for. So there's melanoma and then there's the non-melanoma skin cancers. When it comes to melanoma, thankfully, that one's more rare, but that is the one that's more deadly. And melanoma is what we associate when we think of like dark moles. So, because it's the same cells that make a mole is the same cells that cause melanoma. Melanocytes are those cells. And so when looking out for melanoma, you want to look out for moles that just stand apart from your other moles, usually moles that are much darker, like close to black, moles that are bigger, moles that are changing, and moles that like are itching or bleeding. Like there's symptoms coming from that mole. You want to pay attention to those. And then just like a quick, I guess it's an acronym that people follow is the ABCDEs of melanoma. So A stands for asymmetry. So a mole that's not like perfectly nice and round. I mean, not all moles are perfectly round, but a mole that's starting to become like more asymmetric. One side's more jagged. B is for borders. So yes, jagged borders or regular borders, essentially kind of going with the asymmetry. C is for color. So we talked about looking for a dark or black color, but also variation in color. If one part's red and one part's brown, that's a little bit weird. So paying attention to that. D is for diameter, greater than 6 millimeters, or pencil head eraser is something to pay more attention to. And then E is evolution. So a mole that's changing or causing symptoms, like I said, bleeding, itching. So that's melanoma. Non-melanoma skin cancers are way more common. Thankfully, they're not deadly. I mean, they can be if they're let go and like completely neglected, but usually they're very easily treatable. And these are the basal cell carcinomas and squamous cell carcinomas. Basal cell carcinomas is the most common skin cancer, but squamous cell is a close second. With basal cell carcinomas, they appear as like almost like shiny. They have like a sheen to them, like shiny pink or pearly papules, which are like tiny little, like a little bump. They love the face. They like the chest. They like the back. They like the arms, like upper arms. I mean, they can occur anywhere. I've seen it like on someone's butt, but usually it's the areas that see more sun. Whereas interestingly, melanoma can occur anywhere, but it's areas that don't see sun as much, like the back on men and the legs on women for melanoma, whereas basal cell and squamous cell is like the head and neck, tops
Okay.
of the hands. So that's basal cells, like shiny, pearly pink papule or bump. And then squamous cell carcinoma is a little bit more scaly, like a scaly pink bump that also won't go away.
Okay.
And those both can also bleed easily too.
Got it. Got it. Okay. So if you have a history of cancer, do I necessarily need to like see something to go get checked? Or do you think just once a year, just schedule an appointment with a dermatologist and say, I'd love to get a scan and just make sure everything's fine?
Yeah, I would say if you've had a diagnosis of cancer, that yes, that already gives you a ticket to see a dermatologist once a year.
Okay. Okay,
Mhm.
perfect. All right, Dr. Mamina, thank you so much for being here. This was a really great conversation. And for people listening in who want to reach out to you or follow your journey, how can they follow you?
Yes. Well, thank you so much for having me. I love talking about this stuff. So this
Me
is
too.
great. But they can follow me on Instagram, TikTok, and YouTube. My name is dr.mamina, dr.mamina. I also have a website, drmamina.com. And yeah, this is great. Thank you.
Thank you so much. Thanks for listening to The Other C Word, hosted by Bismolology. New episodes drop Mondays. Connect with me on socials at Bismolology, and let's all learn, grow, and inspire each other.